So have you ever wondered how public health experts actually track disease trends, over decades? It turns out it's way more complex than just looking at numbers on a chart. What really struck me digging into this was just how tricky it gets when they try to understand these long-term health patterns. So today, yeah, we're diving into age-period-cohort models, APC models. They're powerful tools in epidemiology, definitely, but also incredibly subtle. And we're going to unpack some, well, surprising truths about how easily these analyses can go wrong.
Absolutely. We're looking at a really important study today, one that compares different ways researchers try to analyze these trends. And what it found is, well, it reveals some critical biases. These biases can lead to major misinterpretations of health data, really crucial data.
The misinterpretations, like what kind of impact could that have?
Well, imagine if policies, say, to curb smoking were based on data that got it wrong. Maybe the data suggested declining lung cancer was due to a new treatment,
Right.
when actually...
When actually is fewer people smoking over generations.
Exactly. This study shows how easily those kinds of critical errors can slip in. So our mission here is really to give you a shortcut, a way to understand these nuances so you can think more critically about the health insights we all rely on.
That's a powerful example, really drives home the why. Okay, so let's start with the basics then. What exactly are these age period cohort models? Why are they so fundamental?
Right, so APC models, they're a cornerstone of descriptive epidemiology.
Okay, that's the study of disease patterns in populations.
Precisely. How diseases spread, who they affect over time. These models help us analyze things like incidence and mortality rates. They estimate the effects of three distinct factors.
All right, three factors.
First, the age effect. That's pretty intuitive. Risk changes as you get older.
Makes sense.
Second, the time period effect. This captures changes that affect everyone, all age groups, at roughly the same time.
Like you said, a new treatment becoming available, or maybe a big policy change, a widespread exposure.
Exactly. Something simultaneous across the board.
Got it. And the third one?
That's the birth cohort effect. This one tracks changes across generations. So people born around the same time, they might share certain long-term exposures or habits.
Okay. Like the smoking example. Again, different generations having different smoking rates throughout their lives.
That's a classic example, yeah. And these cohorts, visually, they actually form the diagonals in the data tables, tracking groups from oldest to youngest across time.
Okay, that sounds incredibly comprehensive. You get age, the current time, and generational effects. But the paper jumps straight into a major problem, doesn't it?
It absolutely does. This is the core challenge, what's known as the identifiability problem.
Identifiability.
Yeah.
Okay, what does that mean in practice?
Think about it this way. If you know someone's age and you know the current year.
You automatically know the year they were born?
Right. Age, period, the current year, and cohort, year of birth, they're perfectly linked. Knowing two tells you the third. There's an exact linear dependency.
Ah, I see. So in the model.
In the model, it means you can't mathematically isolate the unique, independent effect of each of those three factors, age, period, and cohort, without making some kind of assumption, an arbitrary constraint.
Like fixing one point, or assuming a certain shape for one trend.
Something like that, yes. And because you have to make that assumption, the results you get, the interpretation of how much is due to age versus period versus cohort, it isn't unique. It depends on the constraint you chose.
So it's like having too many unknowns for your equations. You can't get one single answer.
Exactly. You can't pin down the true contribution of each without that external assumption.
Okay, wow. So how do researchers deal with this? Have they found solutions?
Well, they've certainly developed various approaches, different statistical methods trying to get around this problem. And that's what the study investigated. How well do these supposed solutions actually work? The findings were, well, pretty stark.
Stark how?
Yeah.
What did they find about these different methods?
Okay, so one popular type uses penalty functions. They sort of try to smooth things out statistically. But the study found these methods are consistently biased towards finding a linear cohort effect.
Meaning they might overemphasize the generational changes.
Yes, potentially attributing trends to cohort differences when it might actually be a period effect happening or something else. It can mask the real picture.
Okay, what else?
Then there are methods using individual records, more granular data. The idea is to break that linear dependency.
Sounds promising in theory.
It does, but the paper showed these can be seriously biased if there are strong age effects involved, which is, common. This bias tends to push the results towards finding increasing period effects and decreasing cohort effects. And it happens even with small changes in rates.
So not a magic bullet either. Any other approaches?
There are simpler non-parametric tests. They're useful for spotting like nonlinear changes, bends in the trends,
Hmm.
but the study points out they aren't very powerful with smaller data sets. And crucially, if both period and cohort effects are genuinely happening, these tests often can't separate them out. Plus, they don't tell you much about the age effects.
Hmm. So it really sounds like some very common ways of doing this analysis can, well, seriously mislead people.
That's precisely the takeaway. Despite good intentions, these methods have inherent biases that can distort the findings.
So is there any reliable way forward? What does this study recommend?
Yes, thankfully. The core conclusion, the strongest recommendation, is to use methods based on estimable functions.
Estimable functions. Okay, what are those?
Instead of trying to estimate the individual age, period, and cohort effects directly, which we know is problematic because of that identifiability issue, these methods focus on what can be reliably estimated without arbitrary assumptions, things like the curvatures or deviations in the trends.
So not the exact level, but the shape of the change. Like, is a rate accelerating, decelerating, flattening out?
Exactly. You're looking at the second derivative, essentially, the change in the rate of change. These patterns, these shapes, are identifiable and mathematically sound. They don't depend on those tricky constraints.
Okay, so maybe the results aren't as simple to state, like period effect is X.
That's true. Interpreting curvatures might be less intuitive initially than saying this factor went up by Y, but the crucial point is that these results are unbiased. They reflect what the data can truly tell us without forcing it.
And the study basically says, stick to these.
Pretty much. It concludes that only these methods focusing on estimable functions, like curvatures, can be recommended for use in all circumstances. And it strongly suggests that interpretations from past studies using those other biased methods, well, they should be revised.
Wow, that's a big statement. It really makes you appreciate the sheer statistical carefulness needed here. It's clearly not just about running numbers through a program. It's about the deep understanding of the methods and their limitations.
Absolutely. It's about using the right tools for the job and understanding what questions those tools can actually answer reliably.
This deep dive definitely highlights that. Getting unbiased answers is critical.
Indeed. And maybe it leaves us with a final thought for you, the listener, to consider. If something as fundamental as telling apart age, period, and cohort effects in health data is this complex and prone to hidden biases, what other critical conclusions, perhaps in other fields too, might be subtly shaped, maybe even skewed, simply by the analytical methods someone chose, affecting everything from policy down to our own personal choices? Something to think about.